Welcome to the Regional West podcast. Join me to learn about all the great things happening at Regional West and meet the people behind your health journey. As we celebrate a century of care, we are refocusing on the patient experience and reimagining healthcare the way it should be. For moments big and small, we're here for you.
We are Regional West.
Welcome to the We Are Regional West podcast. I'm your host, Julie Franklin. Today, I am joined by Dr. Bradley Hertzler, a surgeon at Regional West Physicians Clinic Surgery Vascular Diagnostics. Thank you for joining me today. It has been an exciting year for Regional West. We are celebrating 100 years of providing care to patients throughout the region and looking to the future. Earlier this year, we produced a video titled We Are Regional West that captures the beginning of West Nebraska General Hospital and how it has evolved to be the regional referral trauma center Regional West is today. You were kind enough to be our spokesperson on the video. Tell us a little bit about why you chose to join Regional West and what the video means to you.
Well, I joined Regional West about 5 years ago. The reason I came to this community is as a new grad from residency, I was looking for a group of people to join who I'd be able to find mentors in. And indeed, my surgical group that I've joined are just made up of wonderful people. And so that was the first thing that brought us. And then my wife was very attracted to the city, the schools, the community itself. And we've loved being here ever since. As far as being on the video, what it's meant to me, even that experience, I did not realize the wide and long history that Regional West has had in our community. I loved on the 100th anniversary going around and seeing the historical moments in the hospital's history and realized I was a part of a legacy of something that was much bigger than myself. So it was a real honor to be a part of that video, to be a part of that celebration, and to kickstart us up into the next 100 years that we're going to have at Regional West.
Well, not only is Regional West celebrating our centennial anniversary, but we're also focused on change and improving our patients' experience. As you know, there's always a lot of change in healthcare, and keeping people updated is a challenge, given that there are so many avenues for people to receive information. It was really important for us to take a step back and look at how we communicate. And once we did that, we realized we had room to expand how we share information. So we started an online community newsletter that can be found on Facebook as well as this podcast. So let's get started talking about what is happening at Regional West. One change earlier this year was expanding the physician representation on the board of directors, including yourself, and creating the Network Operating Council, or NOC, for the physicians clinic. What do these changes mean for physicians and our patients' experience?
Well, number one, adding more physicians to the board has been really important. So the board is made up of some really wonderful people, but I do think in previous renditions of it, it hasn't had some of the voices it needed to understand the really in the trenches type of view of what's going on in the hospital. And so when we added 4 new physicians, we try the best we can to represent what's happening inside the walls of the hospital so that the board can be better informed, not just financially of how the hospital is doing, but really what's happening inside the walls, how patients are being taken care of, and some of the more detailed aspects of the hospital that need to be tweaked or changed or improved for the patient experience.
Well, an interaction with our patients and their families is so important for the patient experience. Over the summer, we participated in several community events. We provided free sports physicals to our student athletes and hosted open house for the new interventional radiology suite. What else is Regional West doing to improve the patient experience?
I think what's really happening is Regional West is getting into the details. I think it's important to kind of acknowledge where we have been, and we've slipped on some of the details in the past years or decades, and I believe COVID really highlighted that reality. But what's happening now is getting to the details, and so having better communication with patients before their hospital experience. We've opened up more people to answer phones, given ourselves the goal that no phone will go without 3 rings before somebody picks up the phone. Getting in touch with a live person. When people are in the hospital, we've initiated family rounds. We've initiated meetings where a multidisciplinary group of staff members talk about every single patient in the hospital every single day to make sure their entire care is coordinated. We've initiated the details of discharge phone calls to all the patients to make sure that we're just not missing the details that I think we're missing before in the patient experience.
Well, and I think we've also really focused on the billing process and looking at that and seeing how that can be improved from the minute a patient walks in and registers for their appointment or their procedure, clear through receiving their bill and having assistance available if there is a question on the billing.
Yeah. I mean, it just goes back to details. That whole understanding of the revenue cycle yes, exactly. When the patient first checks in to getting their bill, we had lost some pieces of that. Those pieces are being regained again. The speed at which people get their bill is hopefully getting better. We still have a ton of work to do. I mean, there's just so many little parts, little details that need to be made better. And we're in the process. And I think every month we're getting a little bit better each time we go.
Another exciting thing coming up is the transition to a new electronic health record called Epic. And one area that patients, I think, will really find beneficial is the MyChart patient portal.
Yeah, Epic is going to be great for us. And nobody anywhere likes to switch to a new electronic medical records, but I really think it's going to be good both for the providers. Certainly there's a learning curve, but it is going to make the hospital notes and organizing information within the chart much easier. But it's going to make it much easier for the patients themselves to be able to see their labs, their notes, all their values. They can keep up on what's going on with their healthcare just as much as their provider can, because it's all going to be accessible through the portal. It's going to be great for patients, I really do think.
That leads us to another area of attention, and that's looking at new services and technology for the healthcare at Regional West, which then also puts an emphasis on physician recruitment.
Yeah. Another big piece. Again, looking back, there's just been some areas we haven't provided the best services that we could to people in the Panhandle and to our surrounding critical access hospitals. There are services that are desperately needed that we haven't provided. So we're doing some major recruitment pushes. We are looking towards cardiology, having interventional cardiology. We are trying to expand our orthopedic surgery line so that it really provides what patients need in our Panhandle, and they don't have to go outside of the Panhandle to provide those. We're adding to our general surgeons so that we can cover more procedures that we weren't covering, such as thyroids and parathyroids before, which has been a gap in the offerings of our healthcare. So yeah, there's been a big push in recruiting physicians, and then not only recruiting them, but working the steps to retaining them, making sure that they feel a part of the community and they want to stay here long term.
Dr. Hertzler, thank you for visiting with me this morning to talk about the changes at Regional West and your contributions to the hospital and our patients. I appreciate your role as our spokesperson for the We Are Regional West video and commercial currently running. Is there anything else you would like to add today?
I think the biggest thing I want to add is that the next 100 years for Regional West, I really do believe, are going to be even better than the first 100 years. There's a renewed purpose, a renewed vision, a renewed passion on the campus to serve what aren't just patients. They're our friends, they're our family. They are the teachers taking care of our kids. They're the cowboys working the ranches to keep our economy moving. It's really personal now to our hospital because we're taking care of the people we know, and there's a renewed passion to do that well and to do that right. So I really think the next 100 years, I'm excited about. The 200-year video is going to be wonderful.
Thank you for tuning in to our first episode of We Are Regional West. We look forward to sharing more information in future episodes. Remember to like us on Facebook and share your favorite episode.